So this week we're looking at topics around autism diagnosis. George, how do people usually go about getting an autism diagnostic assessment?
Well, to get a diagnosis, you have to be referred for an assessment. And so there's different things which might trigger that referral. So when people notice that a person is different from other people, so that might be parents of a young child noticing that the child is different from their peers, or educators noticing that in school. There are also many people who are diagnosed much later in life, and that often happens at times of transitional sort of major life changes, or during mental health crises where a person's autistic differences can really come to light. Jill, can you tell us more about what an autism assessment actually looks like?
Yes, so there are very typically two components to the assessment. The first component is what we would call an informant assessment, and so that's when you would very typically find people who knew the individual who was being assessed and who had known them for a long time, and where possible who had known the individual during early childhood. And then the second element is an assessment that you would do directly with the person who was being assessed. So in terms of the informant-based interview, there are a variety of tools that you might use to structure that conversation. You might use the ADIR, which is the Autism Diagnostic Interview Revised, or you might use a tool like the DISCO, and the DISCO is a diagnostic interview for social and communication disorders. And that assessment would typically last between 2 and 3 hours, so it's quite detailed information where you are looking at patterns in terms of people's strengths, in terms of things that people might find more difficult. You would be thinking about the way that people's skills had developed. And you would use that information in combination with the assessment that you would do directly directly with the individual. So for that assessment, you would typically use the ADOS, which is the Autism Diagnostic Observation Schedule. And that is an assessment that might take sort of 45 minutes, an hour. And it's an assessment whereby there are different modules, and you would use different modules with people who were of different ages. So if you're doing that with younger children, it's very typically a play-based assessment. If you're doing that with teenagers or with adults, you would still ask people to do tasks, but you might have slightly more focus on getting information through conversation. So it's a combination of those two things that you're looking for, but you might include other things as well. And so you might include some information. If it was a child, you might include some information from a teacher in school. You might also want to ask the person to do a variety of other assessments as well. And so I guess the thing that is most important is that those are tools that you would use that would give you information upon which to base your clinical decision. And when you are making a diagnosis, it's usually an approach that you would do within a clinical team. And what you are doing is taking information from those assessments, and you are thinking about the likelihood that autism as a diagnosis is the thing that perhaps best explains the pattern that you have seen in terms of the person's strengths and also the person's, the things that the person finds challenging.
Can you tell us a bit more about whether the tools are good at picking up all different types of autistic people? Is it a sort of one size fits all, or are different tools better for different people?
So there is some debate here around whether or not the tools are better at picking up on people who are stereotypically autistic, and the extent to which the tools might be able to pick up on people who perhaps present differently. I think that you have to know the right questions to ask, and so I don't know whether there is a problem with the tools or whether sometimes there's an issue in terms of whoever is carrying out that assessment and whether they have got an in-depth understanding of exactly what it is that that particular part of the assessment is looking at, and how to kind of probe for that information. So an example of that might be in the section where you're thinking about examples of interests, and whether or not the person who's carrying out the assessment will be thinking about stereotypical interests versus interests that might be more socially typical. And so an example of that might be whether or not if you have an assessment that you're being asked to do around a young female person who is passionate about horse riding, and whether or not you might be thinking about that as being a specific interest, contrasted with if you had a young male who you were being asked to assess who had an interest in trains, for example. I think that often when we think about autism, we might think of an interest in trains as being something that we associate with stereotypical autism. We might not think about an interest in horses in quite the same way.
Are these tools appropriate for all autistic people, or are there some tools that are more suited to some types of autistic people?
So I think different people might answer this question differently. However, in my view, the tools are okay. What you need to be able to do as a clinician, as somebody who is involved in diagnosis, is to take the tools to understand what it is that bit of the assessment is designed to gather information about, and to remember whilst you're carrying out a diagnostic assessment that autistic people will present in different ways, and to think about that and not be drawn into, when you are doing an assessment, what stereotypical autism might look like.